Half a day. As we prepare to move into the likely reopening of our schools, we provide this guidance as a how to for safely reopening our schools. In it, you will find answers to many questions, including the need for physical distancing and types of recommended personal protective equipment and face coverings. You'll also learn ways we will have to rearrange our staff and students in order to ensure those who are opting for in person instruction can do so safely. This guidance is also informed by the technical assistance and advice of many health and safety organizations, including the Centers for Disease Control, Guam Department of Health and Social Services, and the Governor's executive orders. We know guidance is only as good as its implementation, so think of this as the beginning of the conversation, not the end. We know for many of us, this is the toughest challenge that we'll ever face, perhaps in our lifetime. But when it comes to ensuring that public school students continue receiving a high quality education and doing so safely, we must rise to meet the challenge. Now, a message from the Superintendent of Education, Mr. John Fernandez.
Half a day to our parents, guardians, and community members. I'm John Fernandez, Superintendent of the Guam Department of Education, and I want you to know that we are working hard to keep students, employees, and visitors safe as we plan to open for the coming school year. The following presentation will explain some of the work we are doing as we look to reopen schools this fall, as well as some of the changes that parents and students can expect. We know that this year will present many changes and challenges, but I hope you will join us in putting safety first as we work to continue our mission of teaching and learning. Thank you for your patience and understanding. Si Duas Maasi, and please stay safe.
Half a day. My name is Derek Santos, Principal of Inaran Middle School. The PowerPoint presentation you are about to see will address the important areas the public will need to know as we prepare to open schools safely. Although there are a number of important questions pertaining to opening, we hope this presentation will provide you answers to some of those questions. As we address the different topics of our agenda, you will hear from different administrators who took part in addressing the unprecedented challenges we now face today. It is important to emphasize that this was not an easy process or decision to arise to. Unfortunately, we have the undaunting task of not only educating your children, but keeping them safe during this pandemic. With that said, I now introduce Mr. John Wasilowski, Principal of Talafofo Elementary, who will address the Governor's executive orders and CDC guidelines.
Half a day. I am John Wasilewski, Principal, Talafofo Elementary. As we prepare for the upcoming school year, we were guided by the executive orders of the Governor of Guam and the guidelines set forth by the Centers of Disease Control and Prevention, CDC. The timeline for the implementation of the plan and safety protocols were guided by these and other relevant government agencies, including the Guam Department of Public Health and Social Services. After the first case of COVID-19 was confirmed on Guam, Governor Leon Guerrero declared a public health emergency, prompting the closure of kindergarten through 12th grade schools. A subsequent executive order developed the Pandemic Condition of Readiness System, defining which activities were allowable at each level. Through PCOR 3, the following requirements are mandated: 6 feet social distancing between individuals, signage with distancing guidelines, frequent cleaning of surfaces, use of face coverings, occupancy limited to 50% capacity. When the Governor of Guam declares PCOR 3, K-12 schools will be allowed to open. At PCOR 4, schools will be able to open without pandemic restrictions.
Half a day and good day, everybody. My name is Julieta Kaneni. I'm the Community Health and Nursing Service Administrator, and today I will be discussing some brief facts about COVID-19, as we all know it by coronavirus disease. Coronavirus disease is a respiratory disease caused by the SARS-CoV-2 virus. This virus can spread from person to person. Currently, the COVID-19 outbreak is a worldwide occurrence, also known as a pandemic. COVID-19 symptoms can range from the infected person to show no symptoms, we're also known as asymptomatic, or ranging from mild to severe symptoms. In some cases, people have also died due to the COVID-19 infection. Symptoms of COVID-19 may appear 2 to 14 days after exposure to the virus, and people with these symptoms may have COVID-19, especially fever of 100.4 and above, or chills, cough, shortness of breath or difficulty breathing, tiredness, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, diarrhea. This list does not include all possible symptoms, but CDC will continually update the list as we learn more about COVID-19. So how does COVID-19 spread? The first human cases of COVID-19 are likely as a result from exposure to infected animals. Then infected people spread the SARS-CoV-2 to other people. It also spread between people who are in close contact within about 6 feet. It spread through respiratory droplets produced when an infected person coughs, sneezes, or talks or sings. These infected droplets can land in the mouth or nose of people who are nearby or possibly be inhaled into the lungs. It may also spread by touching a surface or an object that an infected person touched, and then that person touching his own mouth, nose, or possibly eyes. People are most contagious when they are symptomatic with signs of fever, cough, and shortness of breath. At this time, it is considered a low risk that COVID-19 can also spread between pets and people. How can I protect myself and others from COVID? Wash hands for at least 20 seconds. Washing hands under clean running water can help prevent the spread of germs. If you cannot wash your hands, use alcohol-based hand sanitizer with at least 60 to 95% of alcohol. Again, avoid touching your eyes, nose, or mouth. That is how germs spread as well. Cover cough and sneezes. Use a tissue to cover cough and sneeze and then dispose of the tissue. When a tissue is not available, cough or sneeze into your elbow. Wash hands following a cough or sneeze and use hand sanitizer if running water is not immediately available. Wear a face covering that covers your nose and mouth in public settings, and please keep mask or face covering on while at school. Wash face covering or cloth mask daily. Stay home when you are sick. If possible, stay home from work, school, and errands when you are sick. You will help prevent others from catching your illness. Avoid close contact with people who are sick. Clean and disinfect surfaces or objects. Clean and disinfect frequently touched surfaces at home, work, or school, especially when someone is ill. You can also find additional resources at CDC as well, what to use to clean. Practice social distancing. Maintain at least 6 feet physical distancing at all times, especially in the classroom, cafeteria. Avoid crowded places. No sharing of instructional materials and toys. Parents and teachers are encouraged to constantly remind students not to share common items such as crayons, pencils, scissors, and toys. Please stop handshaking. Use other non-contact methods like thumbs up or peace sign. Limit food sharing. Each student have a separate food package prepared by cafeteria, and no sharing of food, drinks, and utensils. Parents and guardians, we are in this partnership together. We as GDOE will need your help every day. Before students leave the house, please conduct a COVID-19 symptom screening to ensure that they are not sick. Please keep sick children at home. If you have a thermometer available, please check their temperature before they leave the house. Again, a fever is 100.4 degrees Fahrenheit, and students are not allowed to be in school if they have a fever. If yourself or a child have been identified by public health as a contact to an active case of COVID, please keep your child home for 14 days. The 14 days that public health indicated. Contact your school and let them know. Then students need to submit a clearance letter from public health indicating that they are cleared to attend school. And if you have any questions or concerns, please also contact your school nurse at your respective schools. Parents, please ensure that the school have the latest updated contact information. If you receive a call from the school that your child needs to be picked up because they are sick, please have a plan in place so that your child can be picked up as soon as possible.
I am Sofia Duenas, principal of Teason High School. Cleaning and disinfecting. Schools are working to meet high cleanliness standards prior to reopening and will maintain a high level during the school year. This includes limiting and monitoring the use of electronic devices, manipulatives, and lab equipment, ensuring safe and correct application of disinfectants, disinfecting surfaces between uses such as student desks, computers and laptops, restrooms, and cafeteria tables, timely disinfection of common areas, and choosing disinfecting products approved by the Centers for Disease Control and Prevention. Next, we will discuss personal protective equipment and face coverings.
Buenas and half a day. I am Julie Salas, principal of Upi Elementary. So what do we anticipate when school opens? To ensure everyone's safety, we are following the CDC guidelines. For example, face coverings and masks should be worn by staff and students with frequent reminders and reinforcement on proper use, removal, and washing of the cloth face coverings. Thermal scanning of all individuals who enter campus, hand sanitizers provided in each classroom, and office space, as well as disinfecting solutions that meet the CDC requirements. Posting of signs in highly visible locations, for example, school entrance, restrooms, and hallways, which promotes everyday protective measures and describe how to stop the spread of germs, such as by properly washing hands and properly wearing cloth face coverings or masks. Please alert school officials if your child has any allergy to these products mentioned above, and most importantly, all students must have a completed emergency information and health form prior to attending school with the most current numbers available. In the next slide, you will find examples of the different types of face masks and coverings that may be used. These are examples of acceptable face coverings and masks. These masks are used to minimize the spread of COVID-19 between people interacting in close proximity, such as speaking, coughing, or sneezing, as the virus can easily be spread among those who are not exhibiting symptoms. The CDC recommends wearing cloth face coverings in public settings where maintaining social physical distancing measures are difficult to maintain. The cloth face coverings recommended are not surgical masks or N95 respirators. Those are critical supplies that must continue to be reserved for healthcare workers and first responders as recommended by the current CDC guidance. On the next slide, it will show examples of optional items that may be used or brought to school for extra preventative measures. These are optional items that may be brought to school. For example, face shields, personal hand sanitizers that have 60% or more alcohol content, personal alcohol sanitizers with 70% or more alcohol content, and disinfectant wipes that kill more than 99% of viruses and bacteria. In the next slide, the procedures for campus access will be discussed.
Campus access. GDOE has developed a plan to minimize access to campuses and limit non-essential visitors, facility use, and volunteers. It is extremely important to exclude any student, parent, caregiver, visitor, or staff showing symptoms of COVID-19. Schools must monitor staff and students throughout the day for signs of illness and determine any special or unique needs for students with disabilities related to the planned school-wide procedures. Student screening and staff screening. We ask that parents and staff conduct passive screening from home. Check temperature to ensure temperatures below 100 degrees Fahrenheit. Observe for symptoms outlined by public health officials. And remain at home if students or staff have symptoms consistent with COVID-19, or if they have had close contact with a person diagnosed with COVID-19. Active screening will take place upon entry of the campus for both students and staff. This will include visual wellness checks and temperature checks with no-touch thermometers. We will screen for COVID-19 symptoms within the last 24 hours and whether anyone in their home has had COVID-19 symptoms or a positive test. Each school will designate and supervise campus entry points where active screening will be conducted with all visitors. Next, we will discuss visitors on school campus.
Half a day. My name is Geraldine Pablo, principal at Marshall A. Sablan Elementary School. School administrators will have plans to limit the number of people in all campus spaces while restricting access to majority of the campus. Visitors will be restricted to identified areas for assistance and will not be able to enter student areas unless they are service providers performing their duties. These plans consist of revised office hours that take into consideration student arrival and dismissal times to control congestion. In addition, meetings will require visitors to contact the school to schedule appointments while keeping building capacity within the maximum allowed. All visitors will check in at the identified points of entry and will be subject to temperature screening, required to wear a mask, and reminded to practice social and physical distancing of 6 feet. Procedures for child pickup will be implemented, such as where to sign out a student, identifying a waiting area, and the pickup point so the student will be brought to the parent or authorized individual.
Buenas and half a day. I am Dwayne Mantegna, principal of Ocean View Middle School. Every school will be managing the enforcement of CDC guidelines regarding all students arriving into the campus. All students will be required to wear masks, maintain social physical distancing of 6 feet, and go through thermal screenings upon arrival. There will be greater control in accessing common areas such as the library, cafeteria, and other areas outside of the classroom. Every school will be establishing drop-off, pickup, and parking procedures upon entering the campus, as well as for dismissal times. Next, we will discuss physical distancing and school operations regarding signage.
Half a day. I'm Agnes Guerrero, principal of Luis P. Antillon Middle School, and I'll be presenting on school operations and building structure capacities. School signage is a critical piece to display around the campus to inform students, employees, and visitors of the CDC guidelines. In addition to this, schools will also have physical distance requirements for traffic flow, posting of lane dividers for one-way traffic, and posting of room packs for all classrooms, offices, cafeteria, gym, and restrooms. Building structure and capacities. The areas listed is based on a sample school, so please keep in mind each school will vary, but to give you an idea of what to expect. So in the sample school, the main office, discipline, nurse, and counseling offices are all capped at 2 persons per office, while the library is capped at 15. Additionally, a waiting area may be designated when offices have reached their cap. For building structure and capacities, to comply with social distancing guidelines, each school's building capacity will decrease. Each school will now have a modified layout for classrooms, cafeterias, and other common areas. Keeping students and employees safe are our top priority. Again, in the sample school, classroom size will have to decrease to 12 students for regular and sped classrooms. Please keep in mind every class varies in size, as long as the seating or desk is at least 6 feet apart. Having desks face the same direction is highly advised based on CDC guidelines. Other areas, like the gym, will also decrease to 100 students, locker rooms to 12, restrooms to 4, and the cafeteria to 60, all to maintain social distancing.
Classroom procedures will be implemented to ensure compliance with the Governor's executive orders and the Centers for Disease Control and the Department of Public Health and Social Service guidelines for social and physical distancing. Within the classroom, masks will be worn at all times, and students will be required to minimize movement by remaining in their seats and refraining from moving furniture. Teachers will set up classrooms to implement these social and physical distancing and monitor classroom movement. Teachers will manage restroom use and visits to the counselor, nurse, or main offices to minimize movement to and from the classroom. The school will reduce excess furniture and equipment to maximize space to the extent possible to manage the physical distance requirements.
Lunch and break procedures. Each school will establish procedures specific and workable for their respective campuses. Schools will have staggered schedules for lunch and breaks. Elementary schools will manage the use of the playgrounds to ensure compliance with guidelines, and students will have designated areas during these times outside of the classroom. For schools that will utilize their cafeterias, there will be markings indicating the traffic flow, and the dining area will be set up in adherence to the physical distancing guidelines. For those schools not utilizing their cafeterias, procedures will be established for food to be delivered to the classrooms, as well as for disposal of wet garbage. Again, students will be supervised to ensure social and physical distancing is enforced. Next, we will discuss the 3 instructional models.
Half a day. I am Carla Masnayan, principal of Simon Sanchez High School. The COVID-19 pandemic has changed education forever. It shut down schools all over the world and gave rise to distance or remote learning, whereby teaching occurs remotely and on various digital platforms. When we reopen schools, there will be 3 modes of learning available to our students. The 3 instructional modes will support 2 groups of students: those who are able to come to school and attend their classes, and those who are not able to for medical reasons, for fear of infection, or other personal reasons. Parents who opt for the traditional learning will have their child or children attend face-to-face classes during their designated days. While on campus, they must adhere to all necessary health precautions, such as wearing a face covering, temperature checks, and physical distancing. Students who are not able to come to school will participate in the home learning option and will be supported based on their ability to connect to the internet. Students with reliable access to the internet and a device such as a laptop, computer, or tablet will access the curriculum and submit their work via online or other digital platforms. However, students who do not have any access to internet or a device to use will access the curriculum by picking up learning packets and returning completed work to school. All parents and guardians are urged to reach out to their children's schools and complete the Models of Learning registration form. This form will provide critical information for schools to meet compliance with COVID-19 regulations and provide options for instructional delivery. The proposed groupings and schedule was established based on the guidelines provided by the Governor's executive orders, CDC guidelines, and other resources available from other school districts. All levels, elementary, middle, and high school, will follow the same grouping and sequencing schedule. In order to minimize the number of people on campus on a daily basis, schools will need to divide their total school population into 3 groups. These groups will be determined by an alpha listing of students' last names. This will allow families with more than one child to attend school on the same days. If you have children that fall into different groups because they have different last names, you may request for accommodations so that all students attend on the same days. In order to ease the transition back to school and maximize frequency of classroom contact, secondary schools will return to the traditional schedule of periods 1 through 6, wherein they attend all classes during their scheduled day. This represents a sample month-long sequencing schedule. Again, groups will attend classes on an alternating basis. Schools may provide designated calendars in advance to avoid or minimize confusion. Should there be a holiday any time during the week or a need to shut down the schools temporarily, the schedule will continue from where it left off the previous school day.
GDOE takes pride in keeping all stakeholders informed. Stay up to date with the Superintendent's weekly press releases and news available on the GDOE website and GDOE social media platforms on Facebook, Twitter, and Instagram. You may also access school websites and school power announcements. Stakeholders may also email their respective schools for additional inquiries. Undankalo na saduas maasi for your patience and time in being informed about school opening. We will be providing future interactive meeting platforms. Stay connected.